For bone marrow, I think bone marrow, the areas that shines are subchondral edema. So when you see that bone marrow edema on MRI in the hip, the knee, the shoulder, putting bone marrow into the joint as well as into the subchondral bone can actually reverse that bone marrow edema. And so we have studies where you have the bone marrow edema, you treat it with the bone marrow into the bone, and you repeat an MRI at 9 to 12 months, and that bone marrow edema is gone. And what we know is that bone marrow edema is an independent risk factor for pain. And so we know that when tendons need to heal, they need blood supply. And where do they get the blood supply? They get it from the bone. And if you have bone marrow edema, that means you have a subpar supply of bone or blood flow to that tendon. So if you can treat that bone marrow edema and treat the tendon, you're going to improve your outcomes.
Amazing. And this is a little similar, but how do you choose between bone marrow and adipose stem cells? Which have you seen better results with? And when would you advise for a patient to step up treatments from PRP, which you sort of just addressed?
Yeah. So we talked about when we'd step up from PRP, but looking at bone marrow and fat. So we only have one study, it was retrospective, that kind of compared the two. That was by Ken Motner out of Emory. And so he said we have about 117 patients that had bone marrow and about 115 patients with fat. What he found is that both groups had great outcomes, 80+% success rate. And there was no difference between the two. So I give patients that information. I say, hey, they both seem to be equally effective based on the data that we currently have. So then we look at the patient's body habitus, right? So if they have a BMI of 18, guess what? You're not going to get any fat from them.